We get hung up all the time thinking about what exercise is best for this movement, for that movement, for this part of your body, what exercise is best to do this, how many reps should we be doing, how many sets should we be doing, and we try to really get particular with our exercise. And this doesn't just count for therapists and trainers, this counts for the lay people as well, the people who are exercising. I get hit constantly with the question of, what's the best exercise for this? What should I be doing for this? What exercise should I be doing for this? And there's a whole bunch of different things in both the medical and exercise realm to talk about in this, but I want to talk about how there is no best exercise for anything. There is no best rep count for anything. There is no best set count for anything, and why worrying about that too much can really get in the way of your fitness goals, your training goals, your medical goals, your exercise goals, whatever they are. Worrying too much about the minutia of what you're trying to do, the exercises, which ones you're doing, really gets in the way. We'll talk about all that today on the podcast. Don't go anywhere. We'll hit the intro and we'll be right back. Stop defending mediocrity in our profession. Welcome back, and thanks for joining us on another episode of the Dr. Krol PT and Fitness Podcast. I am your host, Dr. Lee Krol, physical therapist, and you know the deal at this point. If you're made it this far, you need to hit that like, you need to hit that subscribe, you need to hit that share. Tell your friends about this. Let's spread the word. It helps out the channel a lot. I can't thank you enough for the people who do take the time to like this and subscribe and to listen all the way through. All those things really help out. We're going to grow this thing one step at a time. There's no shortcuts, there's no easy answer to it. You just stay consistent and keep doing it, and that's the plan. So what we're talking about today is exercise. What exercise is best? What do we do about that question of what's the best exercise for your hamstrings, your biceps, your chest, your neck? What should I be doing when I have this issue or that issue? And we're going to talk about things mostly from a fitness side today, but I'll touch a little bit on the medical side as well. There's one kind of a small pet peeve of mine, and I see our medical professionals doing this all the time, and it irritates me a little bit because I think it's not professional, I think it's not safe, but we'll talk mostly on the fitness side today. So one of the things that happens is somebody wants to either strengthen something, make something more flexible, make something bigger, look better, leaner, etc. So people ask me all the time, what's the best exercise for this? How do I lose this? How do I lose this? How do I make this bigger? How do I make this stronger? And one of the realities is there is no best exercise. You know, I have a bunch of exercises that I like for a variety of reasons. I think they hit most of the check marks that I want to hit. I'm good at teaching them. I think they're incredibly valuable, but I'm not married to these exercises. What I do is I try these exercises with my people, and if they don't work for whatever reason, I can find a different way to do things. So there's some interesting research came out years ago that was a little hard for us to swallow in the physical therapy and the fitness world, and that was there's a lot of different exercises that can accomplish the same thing. So if we're talking about something like thoracic mobility, which is the part of your spine where the ribs attach, if we're talking about that, there's 20 different ways to make that move better. There's 20 different exercises that people can do on their own to make that move better. Which one's the best? If you're talking about hamstring strengthening, so we're talking about purely making the muscle able to produce more force, you know, what are the best ways to do that? Well, there's 20 different ways to strengthen a hamstring. What are we looking for? What's going to work best is kind of individual specific. So I have a client that I was working with the other day, and I was working with her on push-ups. I want her to get better at doing push-ups. Well, we're finding that there's some elbow issues. She doesn't really enjoy doing them, and it's not easy for us to get around these elbow issues and the compliance issues because she just doesn't like doing them. One thing she told me was, I'd be happy if I never had to do another push-up again. So push-up, I think, is a great exercise, and it's one of the ones I prescribe the most and I work on the most. But is it the best one? Well, for this individual, clearly it isn't. There's some elbow issues, number one, but number two, there's a compliance issue. She does not enjoy doing them, therefore she's not going to do them. So I have to find another way to get that push mechanism for her without giving her the push-ups. So is the push-up the best exercise? Well, for her, no. It's not going to work for her at all. So I have to find different ways to get to the same goal by not using push-ups, if possible. And it's a hard thing for us to swallow. We tend to try to fit the square peg into the round hole, but the reality is there's a lot of different ways to get to a push. We actually started to use some yoga Sun Salutation and sort of snuck the push into her routines with using yoga. I did some under the fence stuff, with the Sun Salutation coming out of a downward dog, and that worked really well for her. Didn't have any pain doing it, seemed to enjoy it a lot more. So the compliance is going to go up with something like that. And these are the things that are really important. There is no best exercise for your chest. There is no best exercise for your mid-back, your hamstrings, your ankles, your glutes. There is no one best exercise. There's a lot of factors involved. But we think of, okay, which one do we have to be doing? And we can say, okay, what do we have to be doing for our glutes? And my initial answer would be, let's start with deadlifting. If deadlifting is appropriate for you, let's start with that. But if we can't get the deadlift right, if we can't protect the spine while we're doing it, you're simply not going to do the deadlift for whatever reason, then we can get to the glutes in a lot of other ways. So all of us have egos. From the therapist side of things, from the fitness training side of things, we all have egos on the prescribing side of things. We like to think that the way we do things is the best. The exercises that we prescribe are the best. We are giving you the best exercise. We have distilled everything out, all the noise, to give you the 3 or 4 best exercises that you need for whatever area you're looking for. And the reality is, I kind of have a hierarchy of exercises. These are exercises I like for a variety of reasons. Number one, I think they're really effective. Number two, I'm really good at prescribing them. I can explain them very well. And number three, I think they're very functional. But if these exercises don't work at the top of my hierarchy, I have no problem moving down into the hierarchy. It doesn't mean these exercises are less effective. They're just exercises that I wouldn't go to first. Doesn't mean they're bad. But if the people aren't going to do this exercise or it just won't uptake with them for some reason, then that's okay. I'm a big fan of crawling. I love crawling exercise. I love floor work. But if I got someone who's got a bad wrist or a problem in an elbow or something where they can't get into that position or maintain it for very long, then crawling may not be something I'm going to be doing with them, even though I can defend the benefits of crawling all day long. It doesn't matter. It's not going to uptake for that individual. If that individual simply isn't going to do it at home, they have no problem doing it with me, but then they go home for the other 6 days a week, or they go home for the other 13 days of the 2 weeks that they're not seeing me, and they don't do it, then it's not going to be very beneficial. I have to find a different way to get to the benefits of crawling with that patient or client. It doesn't matter that it's the best, in my opinion. That doesn't matter at all. There is no best. These are just the exercises I go to first. So don't ever look for which exercise is best. Don't look for what exercise is best for your biceps. Don't look what exercise is best for your hamstrings. There are exercises that people like a lot more. They feel they're more efficient, but if you're not going to do it, or if it's not going to uptake on your body for whatever reason, orthopedic issues, neurological issues, whatever the case may be, then it's not the best exercise for you. It doesn't matter if someone else says that it is. Another thing people get really hung up on, and I think they get overly hung up on this, is sets and reps. So one question I constantly get is, how many should I be doing? How often should I be doing them? And we tend to pull out a couple of standard numbers that people have no problem with. They digest them pretty easily. And the rep count numbers that we pull out are 8 reps, 10 reps, 12 reps, 15 reps, 20 reps, or 30 seconds, 60 seconds. People have no problem with those numbers. If I give them any of those numbers, Nobody questions it. Nobody says, why am I doing 15? Why am I doing 60 seconds? But if I were to tell someone I want you to do 17 reps, I would get a question. Well, why 17? That seems like a weird number. It's no weirder than 15. It's no more unusual than 10 reps. I mean, nothing magical happens at 17, just like nothing magical happens at 10. Nothing magical happens at 20. Really what we're looking for is if I give you a higher rep count or a time on the things that I'm giving you, really what I'm saying is nothing magical happens at 60 seconds, nothing magical happens at 20 reps. I just want you to do a fair amount of them. I want you to get fatigued. I want you to go into a lot of repetitions, meaning that your challenge at the beginning should be very low and it should ramp up. And by the time you get to 20 repetitions or somewhere near there, 18 reps, 22 reps, it's fine, it doesn't matter, then we're getting the goals that we want, we're getting the endurance goals, we're challenging you enough by that point, but we're not having a challenge at the beginning. That's really what I'm looking for. If I keep my rep count low, then what I'm saying is this exercise is going to be really challenging for you. Either you're not going to be able to do it well after 4, 5, 6 repetitions, or your body's going to get fatigued. So really it's not about the exact number. It's more about either the time or the amount of repetitions, which is what we're trying to get to in terms of I really want you to develop high-end power, high-end strength, or I want you to develop endurance or something in the middle, some sort of neurological benefit to it. So it doesn't really matter the repetition count. Don't get too hung up on that. I have people that write it down and they get all particular. And again, I try to tell people all the time, don't get hung up on it. I just want you to do enough of them, or I want you to do just a few of them. I don't need you to do a lot. It's like when I give people medical prescription for repeated exercise, repeated movements. I may tell people, I want you to do a repeated cervical movement, or repeated lumbar movement, or repeated joint movement every hour or other hour that you're awake. And how many do I do then? 10, 15, 20, a minute of it, 30 seconds. I'll give people that prescription, but I'll tell them all the time, this is just a starting point on the dosage. If it's not working well for you, lower your dosage, knock it down to 8 reps, knock it down to 7 reps, knock it down to 10 seconds, knock it down to every 3 hours. If it's working really well for you, maybe we can increase the dosage and see if we get a better benefit out of it. So again, nothing really magical happens at these numbers. These numbers are as arbitrary as anything, the exact number, but the range is really what we're looking for. So when you're trying to figure out what exercise you should be doing, don't waste a lot of time getting hung up on how many sets, how many reps, etc. If you're really training for something very specific, if you're training for a bodybuilding competition, then you can get far more specific on that, but you're willing to invest a lot more time. Most lay people are not looking for that type of time investment on their exercise, and it tends to actually be a drain on their exercise when they start to worry too much about that stuff. Again, really high-end people, elite athletes, stuff like that, we're far more precise on their sets and reps. Lay people, it doesn't matter nearly as much as you think. So my main idea with this is don't get hung up on the particular exercise that you have to be doing. There is no best. You have to find out what exercise is going to work for you and what exercise you enjoy doing enough that you'll actually do it. Single leg deadlifts are great, but if you don't enjoy doing them, but you like doing bridging, well then bridging is going to be better for you because you're not doing the single leg deadlifts. We can try to fit the single leg deadlift in there in other ways, but again, you have to be willing to do it. Your compliance is number one. If you don't do it, it doesn't matter how good the exercise is. You're not willing to do it. So concentrate on the exercise that you're willing to do. Don't worry too much about which exercise. Just make sure the exercise fits what you need. So if you need hamstring strengthening, then make sure the exercise actually addresses hamstring strengthening. If it does that, then the exercise is fine. If you need glute activation, then make sure the exercise actually addresses glute activation in the pattern that you need it. And that's usually where you need a professional to come in and help you out with that. It's kind of hard to figure that stuff out on your own if you haven't been doing this for quite a while. Next thing is don't get too hung up on sets and reps. Like I said, don't beat yourself up saying, oh my God, I gotta do 3 sets. Do I have to do 4 sets? Do I have to do 2 sets? Don't get too hung up on that. It's not as important for most people as you think. If you're really training for something at an elite level, that's a different story. But for 95% of people out there, it is not as important as just showing up and actually doing them. You can program this hard line later on if you want, but don't get too hung up at the onset. Just show up, start doing the exercises, and you'll do a lot better. You'll actually get some results if you're actually doing them and not getting too hung up and worried about the numbers. The last thing I wanted to talk about, I said I wanted to touch slightly on the medical side of things because there is a small pet peeve that I have. And my pet peeve is not with the lay people. The lay people don't know any better. They're going to ask you as a PT, chiropractor, physiatrist, whatever, about, my neck is bothering me. What can I do? Is there an exercise I can do? Is there a stretch I can do? I get this question constantly. And I don't mind getting the question because, they're asking for my help. That's a good thing. They're not just winging it. They're not just, Google MDing it and trying to figure it out. They're asking someone for their help. But what they're saying is, can I just do something real quick? I don't want to go through the whole rigmarole of an examination. Just, give me the one thing. And I see people in the medical community doing this. They just give it out. Oh, yeah, your neck is problematic. You have a problem running down your arm. Yeah, just do your retraction, extension, and that should clean it up. Oh, your back is problematic. Just go into back extension, push the hips forward, and do that every hour or so. You should be fine. And I have a couple problems with that. The biggest one is we don't know what's causing this pain, this irritation, or whatever. We can guess as to what it is. We can use a medical guess, play the odds. But if we don't do an examination to some degree, then what we're doing is we're essentially reaching into our pocket, pulling out a pharmaceutical and just giving it to people without telling them, hey, here's the side effects. Is this even the right medication for you? We're doing the same exact thing, and you would never do that. You would never walk around with gabapentin and hydrocodone in your pocket and just start handing it out to people if they said, oh yeah, I'm having nerve type pain, or I'm having swelling and inflammation. Oh yeah, here you go. Here's, nerve pain here. Here's a gabapentin for you. Oh, you're having swelling? You're having pain around the joint? Here's some hydrocodone for you. You wouldn't do that. No physician would do that. So as PTs, athletic trainers, and anyone really in, prescribing exercise, we shouldn't be just handing these things out based on a somewhat educated guess. We should always be examining people because there's a wide variety of reasons that someone could be having low back pain, and they have nothing to do with the musculoskeletal system. There's a wide range of things that could be causing shoulder and neck discomfort that have nothing to do with the musculoskeletal system. So giving them a musculoskeletal fix for something that's not a musculoskeletal problem, is going to either delay their care or make them worse. And we don't want to do that. Non-malfeasance is one of the big things that we look at in the medical community. So, when you ask your medical professionals, your friends of yours, colleagues, people that that happen to be medical professionals, what can I do real quick for this? Really what you're asking them for is, do you have a quick drug that can just make me better? What you really should be doing for the lay people out there is saying, hey, my neck is bothering me, my back is bothering me, can you take a look at me? Now what you're doing is you're saying, I want to go through the process of getting an examination and finding out what the problem is so I can fix it. That is actually the fastest route to get you better. If you just try and exercise, Google MD it, or they just give you something really quick, it's actually the slowest way of getting better. It's not accuracy. If you don't look at a dartboard, you throw a dart and you just happen to hit a bullseye. That's not accuracy. You just statistically are going to hit a bullseye if you throw 1,000 darts at a dartboard blind. I mean, you're just statistically, you're going to hit one. So the same thing goes with just throwing in random, not as random, but a educated guess exercise out there. It's not ethical. It's not smart. It's not the way we should be doing things in medicine. So again, the lay people, always ask for an examination, always try to find out what the root cause of the problem is. So again, a big overview of this. Don't worry about which exercise is best, okay? Don't focus on that. Don't get hung up on sets and rep counts and stuff like that. Just make sure the exercise is addressing what you need and you're in a range in terms of the exercises that you can do it well. I mean, if you can't do the exercise well, it doesn't matter if you get to 20 repetitions. You're failing at the exercise at rep 3 then you're done by rep 3. It doesn't matter. It doesn't matter where you got to. Either it was too intense if you need to get to a higher rep count, it was too intense if you're failing by rep 3, or the exercise is something that your body will not uptake. You have to make it a little bit easier or find some way to modify it to make it so that you can uptake that exercise. And don't ask your medical professional friends for an exercise or a movement really quick or a stretch to help reduce your pain. Find out what's causing your pain, and then they can prescribe what is the best exercise for you at that time, not just what is the best exercise from an absolute level, because that thing does not exist. All right, there is no such thing as a best exercise for anything. You have to find out what's going to uptake for you, what you're willing to do, and if it's even the right thing for you. Thanks for taking the time to listen. If you've made it this far, you know what to do. Like, subscribe, hit that bell for notifications, share it, Instagram, Facebook, LinkedIn, send it to your friends, send it to your colleagues. You know, these messages I put out here, not because I like to hear myself talk necessarily, but because I think this is important stuff. I think it's important stuff for students to hear coming out of school. I think it's important to hear for entry-level practitioners, whether they're trainers or physical therapists, chiropractors, it doesn't matter. I also think it's important for the seasoned veterans of the group to hear these things and kind of get jarred a little bit into getting out of the ruts that they're in terms of training and treatment. So we need to do a better job overall, and that's why I put these messages out there, myself included. I'm always looking to do better and always looking to improve. This is the Dr. Krol PT and Fitness Podcast. I'll see you next time. We'll be talking about a bunch of different things, whether it's rehab or fitness. We're going to be kind of bouncing around between both because the two fields are interconnected. Like, share, subscribe, and I will see you next time.